So, a psychiatrist is a medical doctor who has specialized in mental health diagnosis, prevention, and treatment. Um, and this is a medical professional who is able to examine a patient who may have mental health challenges and come up with a diagnosis and even prescribe treatments that could include medications, could include psychological support, psychotherapy, occupational therapy, and other lifestyle changes that could be referred to as self-care. This is as opposed to a clinical or a psychologist. Now, there are different levels of specialization in psychology, especially where mental health is concerned. We recognize that you could do a 3-month diploma and be called a counselor. You could do a 1-year diploma and still be called a counselor. You could do a 3-year degree course and still be called a counselor, a counseling psychologist. But beyond that, it becomes a little more sophisticated. You now start to meet with a master's level individual that could be called a counseling psychologist, or a master of science individual referred to as a clinical psychologist. And so there's a difference that the psychiatrist is a medical doctor. The psychologist is not a medical doctor. However, a medical doctor could decide to pursue a study clinical psychology or counseling psychology, and in which case then they would be referred to as a clinical psychologist with a medical degree. And that's the difference, because then a psychiatrist can prescribe medications because he's a medical doctor. A psychologist, a pure clinical psychologist or counseling psychologist, should not be prescribing medications. And the difference in terms of practice is that a psychologist is trained in specific techniques that help to alleviate, through the talking therapy, symptoms or ailments that could be referred to as stemming from their mental health. One should consider seeing a psychiatrist either because they've been diagnosed by a mental health practitioner or a clinician and advised where you are at, you need to see a psychiatrist. Either because you require evaluation for symptoms, like let's say you have insomnia, lack of sleep, trouble with appetite, maybe you are having experiences of, say, hearing voices, seeing visions, thinking you're being followed, or people are plotting against you, or you are the subject of some plot that is aimed at compromising you, or you are having other psychological problems like marital strife, or you've been through a traumatic experience, like, say, you've been in a bad road traffic accident, or you've witnessed some terrible thing happen to a friend, a colleague, a family member, and you are now unable to function without your mind just locking onto that, and so on. There are many, many instances where an individual may need to see a psychiatrist. The benefits of seeing a psychiatrist are one that you may be able to then understand the phenomena that you might be going through, like the ones I've alluded to. But also you will be able to get relief of symptoms. You'll be able to get treatment of symptoms. You may be able to get support from the psychiatrist, even if you're not going to be put on medication. But at least you'll know what is wrong. You'll get an evaluation and possibly a solution to your problem. Mental health in general, or challenges in mental health, have attracted a lot of stigma and myths and false beliefs about it. However, we know that when somebody is having a mental health challenge, almost in 99.9% of the times, they will be having some chemical imbalance happening to them at the brain level. So it's an illness like any other physical illness. In fact, the best analogy to mental health, mental illness, and physical illness is that of diabetes. That a person with diabetes has a problem with their pancreas. They are not producing enough insulin from the pancreas, which is the organ that produces insulin. And so they end up with high blood sugar or symptoms of diabetes. It's the same with depression. A person has a problem in the part of the brain that produces the chemical that regulates mood. And these chemicals can be referred to as catecholamines, namely serotonin, noradrenaline, and to a lesser extent, dopamine. So that part of the brain that regulates mood utilizes those chemicals. And when they're in short supply, when they're not enough, you end up with symptoms of depression. So the organ is the brain, the chemical is the catecholamine, and the problem is depression. The same as diabetes, the organ is the pancreas, the chemical is insulin, and the disease is diabetes.